new report has revealed that millions of dental patients are missing out on the professional care they need as they're having to wait months for an NHS appointment.
Yes, it's led to a worrying rise in some patients resorting to dangerous DIY procedures, including fill-ins and extractions.
So if you're amongst those in need of help, Dr. Rhona Eskander is joining us now with her advice. And we heard these stories during the thick of lockdown of people actually pulling out their own teeth. And that's because you couldn't go out. Everything was shut down. Now it's really hard to get an appointment.
Yeah, absolutely. And I think really the problem started because the dentists were shut down. People were missing their routine appointments. So routine appointments were really important. So diseases that were reversible at the beginning became irreversible because they weren't able to see a dentist. But on top of that, pain patients couldn't be seen. So they were resorting to doing things at home, which led to a huge problem. On top of that, when the dentist did open up, there were so many restrictions. We had something called fallow time as well, which meant that we had to wait a certain amount of time between treating patients. So there was a limit on the number of patients we could see. So the list just kept growing.
Well, we have got lots of people that want to see you and want to talk to you and want your help. So we will start off with Rebecca. Hi, Rebecca.
Hi.
You've got a problem with grinding your teeth, is that right?
Yeah, so I've been grinding my teeth for the past few weeks, which is just getting so bad. I've worn all my teeth down, and one of them has actually broken last week as well.
Oof. Oh, yeah, we can see the image there in the picture.
Yeah. So I'm really sorry to hear that, Rebecca. It's a massive problem as well, tooth grinding, and there's lots of different reasons. So one of the reasons could be that you've got a problem in your mouth, like an interference or so forth. Could also be down due to stress. Now, there are ways to get around this. If you're unable to get to a dentist, you can actually call 111. They're able to triage with you on the phone. If you want impartial advice, free advice as well, there's the Oral Health Foundation. They're a charity and they can also talk to you. If you do need that temporary relief at home, you can pop to the pharmacist. They can give you some advice on analgesics, and you can even do things like try and massage the muscles which cause the tooth grinding, and try and cause and try and also prevent the pain from happening and cause some temporary relief.
Right, OK.
And so if you are one of these people who is suffering at home and you can't get a dentist appointment and you are in agonising pain, what do you do?
It's a huge, huge problem, and I think there are a few things that you can do. So I had already mentioned you can call 111 if you don't have a dentist. Right. They can triage and they can work with dental schools, for example, where dental students can see you and treat you. The other thing that you can do is that you can try and get to a dentist. Some of them will give you advice on the phone if they can't see you, or they can refer you to emergency urgent dental hubs. So there are hubs available for people to get that relief, which is a really good thing.
What about these home dental kits that you can buy in the pharmacy?
So I would steer away from them, to be honest. They can be okay if you're using them temporarily. So, for example, you have these filling kits where if you've got a cavity, you can pop something in there and then you wait till you see the dentist. But they're not meant to be for permanent use, and they won't relieve the problems and the symptoms on a permanent basis.
Kerry says, I'm petrified of the dentist and my teeth are suffering. The last time I went was 3 years ago. One of my molars fell out over Christmas. I'm constantly in pain. I struggle to eat solid food and my gums are also receding. I can't afford to go privately.
Yeah. And again, that is a problem because so many of the NHS dentists were so inundated with seeing people, and because of this backlog that we talked about. In fact, a lot of dentists and dental professionals decided as well to leave the dental profession because of the stress that was caused, because of the PPP involved, the restrictions and so forth. So apart from all the things that I've mentioned, like 111, like the urgent dental hubs as well, there is something called direct access. So you can see hygiene therapists direct access without seeing a dentist, and they will refer you to dentists if it's not within their scope of practice, but they can provide some relief. For example, they can deal with the gums and so forth, and they can assess the teeth to a certain degree.
OK. We've got Maria who says, what is the best way to whiten at home? What's the best way to whiten your teeth?
I feel very passionately about this because, unfortunately,
this is Maria's teeth here, yeah.
So I think that these at-home kits do not work. We've got to understand that there's different ways to change the colour of your teeth. So you've got the stuff that works on the outside of the teeth. So things like black coffee, red wine, smoking, they're going to make the teeth look really discoloured. But then you could also have genetically yellow teeth, or you could have teeth that have the enamel that's been worn down because you've had lots of acid to the teeth and so forth. If it's internal, you can't really do anything about it with the at-home kits and so forth. The at-home kits also have such a low percentage of peroxide. Peroxide is the key ingredient to cause tooth whitening. But if the level over the counter is 1% or so, it won't do much. At the dentist, once you've had a proper diagnosis and assessment, you can get the proper kit. It's like 16% of carbamide peroxide or 6% hydrogen peroxide.
So that's interesting. So those sort of over-the-counter high street sort of kits, you're essentially wasting your money by doing
Absolutely, absolutely. But having said that, there are some things available to help remove stains. But I would really be focusing on electric toothbrushes to remove staining or water flossers to get rid of the staining and plaque between the teeth. Those are much more effective and they'll help keep the stains at bay.
Just in our last 30 seconds, I know that Sarah's on the line, but we've got to be quite quick here, so I'm going to read her question. I've got dental problems for many years. I get constant infections. I now have one tooth left in the top of my mouth. I've lost my confidence. Eating is a problem. I've been trying to see a dentist for over 2 years, but I've been unable to register with any practice. What do you do in that situation if you can't eat?
Yeah, so I'm really sorry to hear that she's been experiencing that. And I think, you know, you've got to try and find some temporary pain relief. Get on the phone to the Oral Health Foundations. They can give you some impartial advice, as I told you, all the steps I've talked about. And even at home, doing things like brushing twice a day for 2 minutes.
You've only got one tooth?
Yeah, I know, this is true. But you know, for people that are in her situation, I think that really you've got to be able to get on the phone to either 111, the Oral Health Foundation, and they need to triage properly to be able to do that. But for people that prevent getting into that stage, you know, they need to focus on oral hygiene as well at home.
Yeah, OK. I think maybe, Sarah, if you hang on the phone, I know you're there, and we'll see whether or not we can point you in the right direction of somebody here, because that is...
that's no way to live, is it? That's no way to live.
Thank you. Maybe, Rhona, you could have a word with her after,
Yeah, perfect.
Thank you, Rhona. Thank you very much.